Hi, and thanks for joining us today. For our project, we researched superior canal dehiscence syndrome. We hope you enjoy. Dehiscence is defined as the release of materials by the splitting open of an organ tissue. In 1995, researchers at Johns Hopkins determined that the condition involves an abnormal opening in the uppermost canal of the vestibule of the inner ear. This may be caused by the bony surface of the canal not growing to its normal thickness during development. In some cases, a head trauma may occur before symptoms appear. There are a number of symptoms involved with the syndrome. These symptoms include vertigo, which is defined as sensations of feeling off balance and dizziness, and oscillopsia, which occurs when objects in the visual field appear to oscillate, blur, or jump around. Other symptoms include autophony, which is when the subject hears their own voice and or breathing unusually loudly, hypersensitivity to sound, and conductive hearing loss. Not every patient experiences each of these symptoms, however. Some only experience vestibular balance issues.
According to our research, a sure explanation for superior canal dehiscence syndrome has yet to be found. Several theories have been proposed regarding the cause of SCDS. According to researchers at Johns Hopkins, SCDS is a congenital problem, meaning that a person with SCDS is born with thin or missing bone over the superior canal. This theory is generally accepted because this is the last part of the inner ear bone to develop in the fetus and infant. Other theories include bone thinning associated with aging, head trauma, especially to the temporal bone, surgical complications and surgeries where the bone over the superior canal is moved, or a sudden intracranial pressure change due to heavy lifting, straining, or a violent cough or sneeze. Benign paroxysmal positional vertigo is one of the most common causes of vertigo, so patients presenting vestibular symptoms like dizziness and nausea could receive this diagnosis instead. It is estimated that 20% of patients with vertigo receive this diagnosis. Meniere's disease is another common differential diagnosis, as it can also cause vertigo and fluctuating hearing loss. Multiple sclerosis can cause similar symptoms like numbness, paralysis, tingling, and balance problems. Otosclerosis is also caused by problems with the inner ear bones and presents as hearing loss, deafness, tinnitus, and balance issues. Paralymphatic fistula is also the result of leaking fluids in the ear and causes dizziness, vertigo, nausea, and vomiting.
A number of tests can be conducted to diagnose SCDS in a patient. Most audiologic assessments will begin with a pure tone hearing test to first identify if there's any form of hearing loss. Impedance testing is used to rule out problems in the middle ear, since SCDS occurs in the inner ear of a patient. Transient evoked otoacoustic emission testing looks at the integrity of the cochlea and otoacoustic emission lengths. A patient with SCDS will see significantly lower emissions in this area. A vestibular evoked myogenic potential test uses air conductor stimuli, and people suffering from SCDS will see lower than normal thresholds in this test.
There is no one audiogram that shows what every case of SCDS looks like. However, many patients with this syndrome will have similarities. The patient from this audiogram shows an airbone gap, which is indicative of conductive hearing loss, a common symptom of SCDS. Since SCDS is a problem stemming from the inner ear, patients who present auditory symptoms of the disease will likely have some form of hearing loss similar to this. There are 3 treatment options that are currently available for superior canal dehiscence. The first treatment option is counseling. This could be helpful in a less severe case of SCDS. Counseling would help patients avoid certain stimuli and prevent recurring symptoms. The second option is surgical intervention. This can repair the superior canal by method of resurfacing or plugging. Surgical intervention includes the middle cranial fossa or transmastoid approaches. The third option is amplification, which would be done through hearing aids. This would help individuals who have hearing loss because of SCDS.
Thanks for tuning in today!